Now that we have learned about the femoral artery and vein of the thigh, let's talk about the nerve. The femoral nerve is the chief nerve of the anterior compartment of the thigh. The origin and root value of the femoral nerve. It is the largest branch of the lumbar plexus. It is formed by the dorsal divisions of the anterior primary rami of spinal nerves L2, 3, 4. As for the course of this important nerve of the lower limb, femoral nerve enters the femoral triangle by passing behind the inguinal ligament just lateral to the femoral artery. In the thigh, if you look at this cross-sectional view, you can see it lies in the groove between the iliacus and the psoas major, outside the femoral sheath and lateral to the femoral artery. The nerve is not included in the femoral sheath as its formation is behind the fascia iliaca, which is forming posterior wall of the sheath. After a short course of about 2.5 centimeter below the inguinal ligament, the nerve divides into anterior and posterior divisions, which are separated by the lateral circumflex femoral artery. That was the origin and course of the femoral nerve. Let's look at its branches and distribution. The trunk gives a branch each to iliacus and pectineus muscles in abdomen. The anterior division supplies the sartorius, also referred to as the M1 branch of the femoral nerve. The posterior division supplies the rectus femoris, the M2 branch. The three vasti and the articularis genu, these are the M3, M4 and M5 branches of the femoral nerve. The articularis genu is supplied by a branch from the nerve to vastus intermedius. Now we will look at the cutaneous branches. Here you can see that the anterior division gives two cutaneous branches, the intermediate and the medial cutaneous nerves of the thigh. These branches are also referred to as C1 and C2 branches. And the posterior division gives only one cutaneous branch, the saphenous nerve, also called the C3 branch of the femoral nerve. Here are both the muscular and cutaneous branches. You can differ between the two by the denotation. M branches are muscular branches and C branches are cutaneous. Two other types of branches are vascular, that innervate the femoral artery and its branches, and articular, those that innervate the joints. Articular branches. The hip joint is supplied by the nerve to the rectus femoris. The knee joint is supplied by the nerves to the three vasti. Here are all the branches of the femoral nerve labelled on a single diagram. To simply add some more. The muscular branches are in red colour. The cutaneous are in blue. And the articular branches are yellow. That is all about the femoral nerve. In the next video, we will go through the muscles of anterior compartment.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.